For waiting. We're going to get started here. I'm Dr. Kate Leisinga, and this is Dr. Stacy Fisher. We're going to be your hosts tonight. We're really excited that you're here, that you get to talk a little bit about skin disorders, some common ones, some not so common ones, and about how some maybe surprising body systems have to do with our skin. Skin being inside and outside of our bodies. So we're going to kind of cover a bunch of those topics tonight. We're really excited about it. Talk about some products for your skin and also talk about some ways to heal common skin conditions. All right, so pretty clear topic tonight. We're going to be doing a little bit more interaction tonight, which I'm super excited about. I love that, going back and forth. So feel free to shout out answers if I ask a question, to raise your hand and join in the conversation. That's what we really want tonight to be about, so that you guys all learn something, something hopefully new for yourselves. Okay, so what is your skin telling you? A lot of times we don't think about our skin as being that barometer of health, that reflection of what's going on elsewhere in our body. But that's really what skin does. It tells us and reflects what's going on elsewhere in our body. So when we look at skin and we look at our own skin, we should be trying to read it for clues and for hints as to where we're going. So a lot of people, if you notice in this image here, will categorize different areas of the skin having to do with different body systems. Not uncommon at all. So we'll see, different regions having to do with different body systems, the nose being one thing, the cheeks being another, right? You can see all of these systems listed here, and this is a whole subscience of looking at what your skin is telling you. We're going to look a little bit more broadly tonight. We're going to talk about how the skin informs us about our immune health, about how it informs us about our gut health. That's a big one. Dr. Stacy's going to spend a whole lot of time on that. About hormones. It can tell us about our psychosocial health as well as detoxification. So our skin can tell us a lot of different things. We're going to try to briefly touch on each of these tonight. Obviously too difficult to go in much depth to all of them, but we'll get started with these. So in the beginning there was epithelium. Epithelium is the cells of our skin. Okay, it's a specific cell type. This covers not only the surface of our body, but it also lines all of our body cavities as well, okay? It also makes up our glands. One of the very first tissue types to happen in a growing baby, okay, that's why I put this little embryo here, is epithelial cells will start to differentiate. They'll start to move to different areas. They'll start to form the lining surrounding our organs. It's really very, very basic to our humanity, this epithelium, and it represents a whole lot of who we are as well, right? The skin is the largest organ. You've probably heard that before. So it does make up a big portion of who we are. Now these epithelial cells will combine and they'll form just about every tissue type that we have during development. Okay, so they do make up a huge portion of us. So it behooves us to pay attention to that and to understand what the epithelium does and how it reacts to different things. So let's talk function. We love to talk about function here at DBC, particularly today, the function of the skin. So help me understand, right? Teach me, what are some of the functions of the skin? Does anybody know a skin function? Shout it out.
Barrier.
It's a barrier, right? A protective barrier. Very good. Any other ones? What does the skin do for us?
Protection.
Yep, definitely protects us, for sure. Protects us from what? Cold and heat, right? Temperature regulation. That's a big part of what the skin does, definitely. What else does it protect us from?
Overheating.
What? Yep, getting too hot or too cold.
Invaders.
Yeah, definitely. Bacterial invaders, right? Protects our insides. What does it keep us from losing?
Moisture.
Moisture, very good, right? Provides a hydration barrier so that we hold all of the moisture inside of us. Okay. What other big thing does skin do for us? It makes something for us. Vitamin D, very good, yes. Vitamin D is made in our skin, okay? One of the major ways that we get vitamin D, almost the exclusive way that we get vitamin D if we don't supplement with it. So providing us with vitamin D, which is super important. Dr. Stacy's going to talk about some really interesting research involving vitamin D in a second. So I think we covered a lot of it, right? Protection from dehydration and heat loss. We missed a big one, which is secretion, right? What are some of the things we know that the skin does is sweat, oils, and it will also secrete toxins. Sometimes we'll have patients come in and they'll talk about a history, a very toxic history. So whether being exposed to different things or ingesting certain things, and they'll have skin disorders because their skin is trying to push those toxins out and it just can't keep up. So aside from the liver, the skin is also one of our big detox organs. Okay? So secreting those toxins through those things is a big part of the function of the skin. We also have vitamin D production, which we talked a little bit about. What about absorption, right? We prevent ourselves from losing water and heat, but we also absorb quite a bit through our skin, more than we probably want to know about, right? You think about all of the things that are in patch form now, right? Whether that's hormones or pharmaceuticals or chemicals that come in patches, that's because our skin, we're just a big sponge, right? So we stick a patch on and the skin will absorb those things. What does that mean about the rest of the stuff that we're coming into contact with every day? Things that we're spreading on our skin, right? I had somebody say once, if you wouldn't eat it, don't put it on your skin, because it's pretty much the same thing, right? You're ingesting that via absorption through the skin. So that's another important point about the skin. And our skin functions as a home for billions of bacteria, okay? It's one of the main parts of our microbiome. You add the microbiome that's on our inside skin, right? Lining our digestive tract, plus our outside skin, and you've got this huge forest ecosystem of bacteria that's very important for keeping us healthy. So skin has a bunch of different functions. A lot of times we don't think about those, right? So very important to know because it affects our health and it affects how we understand what's going on with our skin. So here's a little bit of anatomy of the skin. We have two major layers to the skin. We have the epidermis and the dermis. Okay, these are both epithelial type tissues. Later down, we have the hypodermis. Hypodermis is technically connective tissue. It's not epithelium, okay? The hypodermis is where all of our blood vessels are, okay? So you can see epidermis and dermis are relatively thin compared to that hypodermis layer. When we talk about having a wound, right, we talk about depth of how much was affected, or a burn, right? First, second, third degree burn. That has to do with what layers were affected in the skin. So we've got our epidermis, largely dead skin cells. This is the stuff that you touch, okay? This is the stuff that you can kind of scrape off if you get sunburned, right? That's that kind of dead, keratinized is the way that we talk about it. It's full of a protein called keratin layer that helps us keep moisture inside, okay? That's kind of our exoskeleton, our outer shell layer is the epidermis. The dermis is where the epidermis is born, right? And then it all kind of funnels out. Skin is shed and sloughed off quite a bit, okay? We lose a lot of our skin. It's constantly being reborn and recycled. That's why it heals, right? Because it's being reborn and then pushed out to the surface. That's another important part to know because the skin requires a high cell turnover rate in order for it to heal. So if your body's having trouble making new cells for whatever reason, you're going to have trouble healing the skin. So that's one of the things that we look at here at DBC. How well does your skin heal? Do you have a hard time healing? That might tell us something about how well your cells are regenerating, which can tell us a lot about your overall health. So one of those weird questions DBC doctors ask sometimes, how well does my skin heal? I have no idea. But it is really helpful to look at for those reasons. You'll notice here we've got a couple glands. We've got sweat glands in here. There's also sebaceous glands. They make oils for our skin. Skin loves oils. It needs to be oily. We're going to talk about that, okay? And then we also have hair follicles. These are modified skin cells as well. Okay, so skin, or your epidermis, encompasses a whole lot just on the outside, and it's not even touching on the inside, which Dr. Stacy's going to hit. Any questions about the anatomy of the skin? Pretty interesting stuff, huh? Just think about skin as being this outer layer you could peel off, but it's actually very integrated, and there's a lot of function there. Let's talk about secretions a little bit. That's one of those things that nobody likes to talk about, right? Nobody wants to talk about secretions of any kind. It makes people uncomfortable, but they're really, really important, okay? Secretions being mostly oil and sweat from the skin, okay? Now we talk about skin being naturally acidic, okay? It has a high pH. So if you look at pH, we're talking about acidity versus alkalinity, okay? Which is higher in number, alkaline or acidic? Alkaline, yes. What's neutral? Does anyone know what neutral pH is? 7 is about neutral pH, okay, when we're talking about acids and bases, or alkalinity and acidity. So the skin, we want to see a lower pH. We want it to be acidic. That's very important, okay? Why do you think it's important for skin to be acidic? Any ideas? Ooh, I think I heard somebody whisper it.
To keep out bacteria?
Yeah, bacterial balance, right? To keep all of those nasty, friendly bacteria from overgrowing, correct. It balances everything out, okay? So that skin acid layer is very important. Now, sebaceous and sweat glands are the ones, the sebaceous glands, that's making oil, okay? Sweat glands maintain that correct pH. That's their job, okay? They're constantly secreting to keep that pH where it's supposed to be. Now, what happens if we strip these off, or if we change the skin's pH? What happens to our skin?
Dries.
It dries out, very good. What else can happen? What do we talk about the whole point of having acid, right? What's the whole point of having acid? To maintain, yep, and so you take away that acid layer and all of a sudden you get bacterial overgrowth. Very good. Okay, we call that skin infections, right? Any number of different things can infect our skin: bacteria, candida, fungi, viruses even, okay? So we talked a little bit about those things, okay? So if we change that skin's pH, then we have these bacterial fungal overgrowth, and we have rebound oil secretions. This is a catch-22, folks. If you strip the oil from your skin is going to freak out and make more oil, okay? This is this cycle that some people get in with very harsh detergents on their skin. They feel like, oh, I have such oily skin all of the time. I need to get rid of that oil, right? Especially on the face. A lot of people struggle with that. You're actually perpetuating a cycle, okay? By not replenishing and taking care of that acid layer, those lovely, lovely oils for our skin, if we strip them off, our skin just wants to make more, and so that can cause clogged pores, acne, a lot of different things. Do you see how that's kind of counterintuitive, how that could be confusing, right? You see oily skin all the time. You see it on commercials, right? Do you have oily skin? Well, use this soap and scrape off the oil from your skin. Every time I plug my ears, la 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 la, I don't want to hear it, okay? It's bad. We need to replenish those oils, encourage that oil secretion, okay? That's what we need to do. We're going to talk about how we do that next. So we have a couple categories of skin disease, and we're going to run through some examples here in a second. But we have outside-in skin diseases. Can anybody name an example of an outside-in skin disease? Something, huh? No, simpler than that. So something from the outside is affecting your skin and causing a reaction.
Eczema?
Eczema is usually inside out. How about poison ivy? Right? Poison ivy is going to be outside in. That's what I mean by that, okay? Poison ivy, something comes from the outside, touches your skin, spreads some sort of toxin or oil or something that spurs on your immune system, your immune response, and that's what we're looking at, right? That we treat totally differently than inside out, like an eczema or a psoriasis or even acne, okay? Is it itchy or not? That will determine the class of skin disorder that we put it in, okay? If it's itchy or if it's not itchy will help you determine what you're dealing with. Is it an infection or a toxin? Okay, that's also important, right? Is there a live something that's infecting it, whether it's bacteria or candida, or if it's a toxin like poison ivy or a mosquito bite, okay? So you can see how skin gets really complicated really fast because you have to figure out, in order to treat it, what category this falls in, right? If you're trying to treat an inside-out skin disorder like it's an outside-in, do you think it's going to work? Probably not very well. Maybe temporarily, right? Steroid cream for a while, right? But that's not going to fix the problem if you're not treating it correctly. So let's go through a couple, see if you guys recognize some of these. We're going to play Name That Skin Disease. Super fun, right? It's the kind of stuff I like to do on a Friday night. So we've got this one here. Okay, you can see some flaking is occurring. It's a little bit raised. This skin disease is noted on the extensor surfaces. So elbows and knees is a very common place to get this. Very good. Psoriasis, okay? This is one of our inside-out skin disorders. Very autoimmune flavor to this one. Well, how about this one? You can see a lot of red bumps, okay, here on the face. That should give you a little bit of a hint. Red bumps here as well. Doesn't look very comfortable, does it? Some of these, you probably can't see it very well, but some of them have little white spots in the middle. Very common on the face. Any guesses?
Acne.
Very good. Oh, sorry, that's eczema. You're right. It's not acne. We'll get to that one next. But eczema here, or dermatitis, this is more of just a generalized dermatitis. Eczema is here on the face. We also see that in crevices. So that's one of the distinguishing features between an eczema and a psoriasis. Okay? Psoriasis you're going to see on the outside. Eczema you're going to see on the inside. Okay? Anywhere that's kind of moist. Here's your classic. Okay? You can see here on the back, here on the face. There you can really see the white spots. Here's our acne vulgaris, okay? Very, very common issue, especially in people with going through hormonal changes, whether that's pubescence, right? Teenagers, or women going through menopause will often have recurrence of acne vulgaris as their hormones change once again, which can be very distressing for a lot of reasons, okay? This is where I find people struggle with knowing what to do with oils, right? They just get this idea that they have to strip all those oils off because they feel like they're clogging up their pores, when actually this is a bacterial overgrowth. How about this one? Redness, very characteristic on the cheeks, okay? And can become swollen and look similar to acne here on the face. Any ideas? Very common in women? Rosacea, very good. Yep. Another inside-out one. And then here we also have underarm, okay? And then I'll tell you right now, this is a butt crack on a baby, okay? So what do we got? Diaper rash or candida rash, okay? Very, very common. Candida being the natural perpetuator of this, candida being a type of fungus, okay? A yeast, actually. So we treat these totally differently as well. So let's talk about some topicals. That's where I'm going to hit, and then Dr. Stacy's going to talk a little bit more about some of the inside-out things, okay? So I'm going to give you a rundown. We have at DBC loads of different topical choices, right? Stuff that you put on the outside to help with skin disorders, especially for those that are outside in. Remember the difference between inside out and outside in. Again, these can be very nice for calming down symptoms, but unless you find the source of the issue, a lot of times it doesn't become a lasting solution for you. So you have to always look inside out as well as outside in. Look to that inside skin for more functional solutions. But we'll just go down these. Deep Skin Healing Salve. This is my go-to for any candida. okay? So if you have any sort of fungal overgrowth, like an athlete's foot, okay, that would be a good one. Or your diaper rash. This is a wonderful, doubles as a diaper rash cream, okay? Anything that's itchy, I love to put this deep healing salve on, or anything that wants to flake, okay? Not so great for open areas, right? We want to stay away from that. We've got a different one for that. But very, very nice for any really irritated skin. Eczemas count in this as well. Dermatitis is kind of my go-to for any very irritated skin. EpiShield, very nice for psoriasis. Anything that needs a barrier, okay? Something to keep things from coming out because it's a little bit, we'll say that barrier has been complicated, all right? It's not intact anymore, okay? So if you have that flaking off like with a psoriasis, that's gonna be very good. Very hydrating, and it also has something, an extract from coconut in it, so it's antimicrobial, antibacterial too. So a lot of benefits to EpiShield. Nourish is my everyday anti-soap, okay? We talked a little bit about pH before and about how we don't want to strip that acid off. Well, a lot of soaps are made with something called lye. Who knows what lye is? Anybody know what lye? Very, very corrosive, right? You'll see in some like mobster movies that they'll use lye to dispose of dead bodies, right? You think about spreading that on your skin in soap.
It's Drano, isn't it?
Yeah, it is. It's Drano, absolutely. So why do we make soap out of it? Well, that's because we are under the impression that we're supposed to strip those oils away. Not true. We want to replenish oils using this Nourish, okay? Yes, there are some areas of our body that do need to be actually cleansed, right? Armpits being one of them. But most of our skin doesn't need that harsh stripping away. We don't need that alkalinity on top of things, okay? Even baby soap. I was looking up some different pHs. Johnson & Johnson baby soap is known to have a pH of 9.7. That's on the extreme end of alkalinity, okay? So think about what that might be doing to baby skin, drying it out, right? Even just tap water, a research article that I read, even just tap water can raise the pH of a baby's skin in 10 minutes. Don't want that. We want to bathe our babies in healthy oils, and Nourish is a good way to do that. Sting Stop is next. This is my go-to for poison ivy or any sort of itchy bug bite, rash, sort of outside-in thing. Amerigel is for wound healing, okay? It's got an extract of oak in it that is very, very antiseptic, okay? So we can use this for post-surgical scars. It was actually developed for diabetic ulcers. That's how strong it is, okay? So very, very effective is Amerigel. And then my go-to for rosacea is Cebu oil or Cebu soap. It's made from a sea buckthorn berry, okay? Very, very effective at reducing the redness of rosacea. You only need a teeny tiny bit, and we do have it in a bar form that's not going to strip the oil. It's just the oil then in kind of as opposed to a dropper of oil as well. For a resource, if you're interested to look at the soaps or products that you do use at home, if you've got a whole medicine cabinet full of skin issue products, look at this website. It's called ewg.org, okay? ewg.org. Any of you ladies who have attended one of our ladies' nights for skin products are going to know that how useful this ewg.org is. It helps you rank your bath and beauty supplies, soaps, that kind of thing, by toxicness or healthfulness, okay, on a 0 to 10 scale. Is that what it is? Mm-hmm. So very, very useful for checking out what you do have at home, and can be a little bit alarming. I know people who go on this website and then dump a bunch of stuff out of their cupboard because of what they find. So very useful information for you there. And speaking of ladies' night,
Yes.
we have another ladies' night running. What's the date on that?
March 18th.
March 18. If you're interested in learning more about skin products, Dr. Stacy and Dawn, are you going to be there for that? They're going to host another ladies' night and talk about those things. So there are still spots available as far as I know. So if you're interested, you can sign up for that. Any questions on the topicals before we move on? No, that's a lot of information. Again, skin issues are very person to person, right? But if you know that some of these things are issues for you, talk to your DBC doctor, talk to one of us after and see if there's one we might favor over the other. It is important to kind of switch it up a little bit. If you use deep skin healing for a couple months, you may notice your body is going to shift and change, and a different one would be more appropriate for you secondary to that. So again, it's a little bit of playing around, touch and go sort of stuff too. I think Dr. Stacy's up next. She's going to talk more about the inside skin.
Sounds great. Thanks, Dr. Kate. So I've got a little bit more of in-depth for you as we go through. So most of us don't think about the skin as becoming from the digestive tract being the main component as to why our skin is reactive. A lot of us just think, oh, I got to put something on it, take it away, it'll fix it. Really, most of your skin issues do come from your digestive tract. I want to cut back and talk about what Dr. Kate had said. The first thing that develops is the epithelial cells. The epithelial cells basically line every organ system within the body. And what you're going to find is that there's layers, and the epithelial layers within the digestive tract absorb or help to produce immune function. So what I put up here is the cells of the different parts of the digestive tract, just to show you what kind of surface area and blood flow is in here. The esophagus is very much a more harder form of your epithelial layers. Not a lot goes through there, it's just mainly a tube from start to the next section. So your stomach, you're going to find you're going to have less of your openings here. See how these villi here only have small areas? Basically what that does is that produces mucus to help with the hydrochloric acid that's released in the stomach, because the acid, if it gets to the epithelial layer, will break it down, just like within other areas of the body. So that's where we get ulcers if we're not producing enough mucus. Now the interesting part within the small intestine, which is where most digestion happens, this is the excitement of the digestive tract, the microvilli and the villi are very important in the small intestine for your epithelial layers. The villi actually, oh, what did I do? Sorry about that. The villi will increase your absorption by 10-fold. The microvilli increase absorption by 20-fold. So very interesting as you're looking at the digestive tract, how much is actually happening within the small intestine. Now the large intestine, this is basically more of a holding vat for when we start to excrete. So you're not going to see as much of the microvilli and the villi within that area. Has anybody heard of MALT? The mucose associated lymphoid tissue? Has anybody heard of that? Okay, so basically this is part of your immune system that was built with you as you were born. There's different layers that it's found in. In the digestive tract, it's actually called GULT, because it's gut-associated lymphoid tissue. Within the thyroid, it has its own name: skin, eye, breast, lung, and salivary glands. So there's a lot of immune system throughout our digestive tract, or without our body. The largest mass of lymphoid tissue falls within the digestive tract, so this is a large portion of the immune system. So with many of our seminars, if you've been to other seminars of ours, you're going to find that we talk a lot about being the digestive tract, part of the immune system, up to 70% of the immune system. So if you want to have healthy skin, we need to have a healthy digestive tract. What is GULT? So what I did is I came up with a couple different articles, and I picked out the one that I thought was the most important from the National Institute of Aging and Infectious Disease. So what they found is that the GULT within the digestive tract, when the body is under an immune attack, the metabolic role of that epithelia will actually change to immune system roles. So basically when the immune system is turned on, we're not digesting or absorbing nutrients. So when we have a reaction on our skin, a lot of times that is showing that we're not absorbing nutrients. A lot of your celiac patients can have a skin rash that shows up that's called dermatitis hermatiformis. Basically, it's like an itchy, raw, boily, white, red area And what that shows with that is you're going to see that that's the celiac of the skin is what they call that. Now when you get the celiac of the skin showing up, what is showing up there is basically decreased digestion and absorption of nutrients. Most of your celiac patients don't absorb fats well. Why? Because the GALT is chronically activated, okay? So let's talk about some things that actually can help to work with the intestinal tract. I'm not going to cover as many things as we have in Nature's Remedies because I could keep you here all night into tomorrow and the next day, okay? So I'm going to talk about some high points that everybody could use to keep their body balanced and healthy. Most people know about probiotics, correct? Okay, so what are probiotics important for? Why do we need these? Anybody?
Bacteria.
Correct. Does anybody know how much bacteria is in our gut?
Trillions.
Correct. I love it. So there's over 1,000 different strains of probiotics that are available, and these are all the different bacteria that could be in our digestive tract or within our body. So there's different bacteria that's within our vaginal tract compared to our gut, compared to our skin, compared to our lungs. We are now learning much more about probiotics, which is why you're going to see different probiotics hitting the market that are meant more for colds and flus, and a lot that are more meant for digestive disorders, and then some that are meant for yeast infections or urinary tract infections, okay? So basically probiotics, most people know that they work to build the immune system up, but they support digestion as well. This helps us to absorb our nutrients. This also helps with control of intestinal cell growth and differentiation. That microbiome is what helps to keep the intestinal tract healthy, right? So when we're talking about probiotics, we're going to get a little bit into what we need to look for within a probiotic. Quality is really tough to decipher. Most people had seen the article coming out of New York State and how they took different herbs off the shelves at different box stores and found that the label claim was not met. Some of them found house plants within the herbs, so they made them take a lot of those out of the stores. So that's just one function showing that we're not as on top of things as we think we are within our supplemental industry. So Dr. Denboer is pretty picky about what he puts in Nature's Remedies. So one of the things that he likes to point out with probiotics, number one, we recommend that they're cold. If you're taking a warm probiotic, the likelihood is that they're not going to meet the label claim, at least by expiration date. Probably when they packed it, but the question is, by the time it gets to you, is it still there? And that's where independent assays come in. So if you have one, you want to call the company and say, okay, did you pull an independent assay on this? I want to know what this batch has, you know, because every company should be doing that. The other thing that I look at a lot of times is Lactobacillus acidophilus. A lot of people know about acidophilus, correct? That's one of the primary bacteria that we've known for a long time works within the gut. How do you know it's a good acidophilus? Anybody? One of the things that we use is this, see this little NCFM behind here? That's the strain that they use that you can look up this strain and look up Lactobacillus acidophilus, NCFM, and you're going to find all the research that supports that yes, this does make it through the stomach acid. Yes, it does proliferate within the small intestine. Okay? So these little identifiers, so basically this is like saying, okay, I have a dog with Lactobacillus acidophilus. The identifier tells you that I have a St. Bernard. So then you know what breed it is, okay? You can find the studies. The Bifidobacterium lactis, the BIO7, you can look it up under this and find out what the research is behind it, okay? So if you're not seeing these on your probiotics, we question, what is the strain? Does it make it through? Do we know? You don't really know, okay? A little bit about food. I'm going to jump a little bit as my brain, I tend to follow a little more ADD, kind of like Dr. Denboer. So what we're going to see here is, why is food important? Because food can break down your internal environment. A lot of us know that the research studies behind inflammatory foods will break things down, but what I picked out is gluten. Gluten can affect the skin. We do know this. We've seen this through research. We know that it can create neurological disorders. It can create cognitive dysfunctions. But basically it's going to affect primarily within research. You're going to see the skin, respiratory tract, and gastrointestinal tract have the strongest research behind this. Now, what they found though is if you keep a child off gluten from age 0 to 2, you can prevent chronic asthma and allergies up to at least the age of 13. Pretty neat. So, didn't realize that as you start to look at things, but that's how important it can be. We do, as you notice through our fields, what is one of the first foods we give babies? Cereal. Yep. So are we possibly breaking down the digestive tract at that point? Yeah, maybe they don't have the maturity of the immune system to break that food down. Maybe you're breaking it down earlier than what it should be, which is why you'll see a lot of young kiddos with eczema. And that's because digestively they weren't ready to have something and we've broken the barrier, okay? Casein. This is the dairy protein. So I know a lot of people realize that lactose is what they think is going to be their sensitivity, but most commonly it's the dairy protein for us to break down. This is a very hard protein to break down. When we intake dairy, research has shown that it can slow our digestive tract from 4 to 6 hours, depending on how well we digest. That's a lot of time. Usually we eat every 4 hours, so by the time we're close to clearing it, the body's ready to have more. So that could slow us as our digestion, and that could break the barrier down. Now, most of the time, people will say, I grew out of my dairy allergy. How many times have you heard that? What happens is it trends to move towards asthma or allergic rhinitis. You'll see a lot of people sniff constantly or clear their throat. That can be allergic rhinitis. And that could be a dairy sensitivity, a casein sensitivity that has moved on from skin or digestive complaints to nose and sinus, okay? This is a big mucus producer. That's one of the reasons that we do take this out with a lot of our asthmatic kids. Anybody that has a cough going on, even if you're not sensitive, if you're coughing at that point, I'm going to pull it out because I don't want to create mucus. If you talk to a lot of people who sing, they won't drink milk before they sing because they know it can create mucus and alter their singing voice. Eggs is also on one of the top 7 lists. This one, if introduced too early, also creates imbalances within the digestive tract and makes it harder for the kids to digest or us to digest. Soy and nuts have quite a bit going on here, and this is mainly because we started to move baby foods into soy. Instead of dairy form, we now moved it into a soy isoprotein isolate. If this is avoided in the first year of life, we can decrease the risk of any eczema, allergies, or asthma as well. That's pretty neat. But a lot of times, yes?
Does it become product with GMO?
It depends. Because some of your soy is genetically modified, supposedly organic is not, but most of your baby foods are going to be a genetically modified soy in this country that I know of. But remember, if you look at baby foods, what's the next ingredient? Sugar. Yes. So another inflamer. So I cannot ever leave food as a culprit without talking about sugar. Sugar can be one of the most primary problems in our diet. If you look at a packaged item, how many times do you see sugar on the label? High fructose corn syrup, anything like that. Yeah, Dr. Denver and Dr. Kate was just discussing a patient that he had seen the past 5 months, the gentleman had gained 20 pounds. And he looked at Dr. Denver and he says, the only thing I've done is I've started to sweeten my tea with a little bit of honey. Twice a day. 20 pounds in 5 months. That's all he's done. He had been down, very healthy, doing great. That's how much it can change somebody. Ah, the big one. Vitamin D is very exciting. Vitamin D came on the market about, many years ago, 8 to 10 years ago. Probably not too long after I started working here. I love vitamin D because this is something that we live in Michigan. We don't get a lot of sun here. We're above the equator. It's definitely a sign we have more seasonal affective disorder. We have more depression in this area, a lot of anxiety, cognitive disorders. A lot of those relate to vitamin D depletions. People don't usually get the flu in the summer, correct? Why is that? Vitamin D levels, right? Okay, so vitamin D, when you have a low vitamin D status in your body, it can make your keratinocytes dysfunction. So it can break them down. So we can have breakdown of skin as well. So your skin won't rebuild and regenerate the way that it's supposed to if we're low functioning vitamin D, which is why you'll see a lot of autoimmune disorders have rough skin, dry skin, struggle with keeping that moisture and hydration in, like Dr. Kate was talking about. Now, vitamin D has long been thought of as a hormone instead of a vitamin. It works like a corticosteroid, which is basically, it has anti-inflammatory properties. So using vitamin D can keep inflammation down in the body. what I had found was a bunch of great research on vitamin D, and one of the big things that I saw was that the vitamin D receptor, vitamin D can affect the translation of over 913 genes in your body. That's quite a bit when you think about it. That's why your skin is the largest organ. It has all those vitamin D receptors. We need a lot of vitamin D to keep our body healthy. There is no cell in your body that doesn't require vitamin D. So basically, those genes can work anywhere from calcium metabolism to expression of the key antimicrobial peptides. What I found with this, which was really, really great, I pulled off a website which is called the Marshall Protocol Knowledge Base. And what they said is when bacteria creates lignans, which like 25D, which is the vitamin D that we take supplementally, they inactivate your vitamin D receptor. When you inactivate that vitamin D receptor, you basically turn off your body's natural immune system. When you do that, that's going to allow your microbes to proliferate. So, thinking about that, the body is then going to take the 125 vitamin D and turn it into 25 vitamin D, which is then going to create a low 25, it's going to take 25 and create into 125. Sorry, it goes from liver to kidney, which is then going to create a low 25 vitamin D, which is your supplemental vitamin D. So when we have bacterial overgrowth in the gut, when we have bacterial overgrowth on the skin, anything that changes our immune system, you are going to need more vitamin D. So the 400 to 800 IUs that we recommend just as a basic natural, that's not even close to enough. Most of our patients are 5 to 10,000 through the winter that we find keeps them at least up into the 40 to 50 vitamin D range. I like to see my patients in the 60 ranges.
Can you overdose on D?
Yes, with everything you can overdose.
And what's that? What's the limit on that?
Most of the time, there's not a limit for dosaging because everybody's different. Like I have some patients that I can do 25,000 IUs, but they don't recommend like the 50,000 IUs they'll do once a week. So I actually rather do 10,000 every day to keep it balanced throughout the body instead of high dosing at one time. Most patients, we really don't go over 20 to 40,000 at a time. And if we do a high dose like 20,000, it's because we're sick. And we're trying to boost the immune system, allow those to shut down those bacterial lignans. Okay? L-glutamine. Most people understand that the body needs nutrients to heal. Now, there's specific nutrients that work in different areas of the body more effectively. Glutamine, which is most common in our office as L-glutamine, is the most abundant amino acid that you have in your body. Okay? Your body actually uses this for fuel and for rapidly dividing cells. Where do you think the most rapidly dividing cells are in your body? Intestines. Yes, intestines. So, glutamine can maintain your gut barrier function. A lot of us actually struggle to make enough of this, or we don't get enough of this in our diet. Now, one side note that I absolutely love is glutamine can reduce insulin resistance, which is the topic of our next seminar. So, giving you like a boost ahead. So not only is it going to heal the digestive tract, it's going to help to reduce blood sugar imbalances, which is going to prevent diabetes. Oh, I love this. Has anybody seen the New York Times, this article from the New York Times, Younger Skin Through Exercise? This came out, I believe it was last year, April. Basically what they did is they took buttock skin biopsies, and the reason why they used buttock skin is because it's less likely to be affected by the sun. Most of us keep our buns covered up. So what they found is they took buttock skin from anywhere between the ages of 20 to 70-year-old patients, right? And what they looked at is the dermis and epidermis layer. Now, with the elderly patients, so are above 40s, they're finding that the epidermis is thickening, which is this top layer. The dermis layer is thinning, so it allows the skin to sag. You got a heavy layer on a thin layer, allows skin saggage, correct? So that's where we see aging. Now, what they had found is that as we age, the outer layer thickens, and what they took is they couldn't decide, is this just exercise or is it the diet, whatever? So they took patients 65 and older and had them do 2 times a week. 65 minutes exercise, either cycling or jogging, a moderate to strenuous, only 2 times a week for 65 minutes. They took their biopsy of their skin, and then after 4 weeks, retook another biopsy of the buttock skin. And they found that the skin was already changing to be more like a healthy 20 to 40-year-old skin. So exercise can improve your skin's function. They don't know exactly through what means, what receptors are turned on, what activates in there, but this is very interesting because how many of us go home and say, I don't have enough time to exercise? How many people make it into their everyday protocol? This is twice a week at 65 minutes. What if you only did 4 times a week for 30 minutes each? You could change quite a bit. So if you're complaining about saggy skin, you're worried about that nice tone, start exercising. No, we're not going to take samples of your buttocks. Sorry. So basically, they thought that it's the myokines and substances that are involved in the skin changes. But I thought that was very, very interesting because it's a struggle for me to get patients to work out more. And if this is, for us ladies, vanity is a big thing. We don't like to see wrinkles. This is a great way to help to prevent it. If you notice, a lot of people that work out that aren't really your endurance runners or over-workout, you'll notice that they do look younger longer. Have you not looked at Dr. Denbour? Does he look like he's aged in the last 10 years? Not at all, right? Very little, if not at all. It's because of the workout routine and the healthy eating. You can't lie about healthy eating. So let's recap. Let's talk about how everything works together. Now, obviously, if you walked into Nature's Remedies, we could talk about Endorphin. We could talk about Ultra Inflamex. We could talk about every other probiotic, every fish oil, anything that's in there could relate to health of the skin, but I didn't want to keep you here all night. So as you look at basically the web of health or our wheel of health, your skin can be affected by basically anything that's happening in the body. So digestively, hormonally, which we didn't talk about a lot this evening, and basically because hormones can be worked a lot of times by working on the digestion function or the health of the digestive tract. So if you get that balanced and the hormones are still off, then you work on the hormones and you can improve the acne of a female skin, if that's the culprit in the end. Detoxification. Liver is super important here. Your liver and your kidneys to detoxify out these chemicals that the body produces or chemicals that we put on our skin. The liver does play a key role here, which goes back to healthy eating. We need lots of good green vegetables. We need to eat a rainbow every day. That doesn't mean potatoes are the only white part of your rainbow, okay? So don't forget daikon radishes and onions. Those are all great whites, all right? But don't forget the purples. Purples are tough for a lot of patients to get in. Blueberries, cabbage, eggplant, those are all great purples as you're working to get into those. I don't want to take away Dawn's thunder away from health coaching. But as you're going to see that there is everything that we work on, even going to the point of relaxation can affect how your body digests, how your skin functions. If we are chronically stressed, you're turning on cortisol molecules, which over time help to break down your immune system. Immune system in the gut, the immune system on top of the body. So it's important to keep ourselves in check. So whatever that means to keep you relaxed, deep breathing, exercise, reading a book, talking with somebody, cleaning the house for an oxytocin release for ladies, guys going out and tinkering in the garage, whatever that is, we all need to shut off our brains from time to time. Don't forget reading the Bible is a great way to relax as well. Okay? So, any questions so far? Hey, we did a good job. References? Not next month. Next month we will be taking the month off of seminar. So our next seminar will be in May. And I believe that is May 4th. We will be talking about diabetes, insulin resistance, type 2 diabetes, that kind of stuff, okay? So we will be very excited to welcome you back in May as we go through. Don't forget that we do have Ladies' Night coming up on the March 18th, and Zumba classes are running all the other Wednesdays. So if you have not signed up for Zumba, Denise is running another 6-week course. Very fun, very exciting. So good way to get some movement in for those of us that make excuses not to move. Okay? Any questions? Yes?
Yeah, for psoriasis then, I know someone who's on the biochemical injection Enbrel. Do you know what that's doing to control the psoriasis, and what other damage it might be doing within the body?
I think Enbrel is, it's an immune suppressant, I believe. And because psoriasis is an autoimmune disorder. That's how we treat in regular medicine, I'll say, or in regular allopathy. They will just try to squash the immune response, basically, by any means necessary, whether that's steroids or whatever it is. And so, obviously, there are some nasty side effects to having a constantly squelched immune system, like frequent infections. I mean, there's lots of different things. So instead of going at it where we just try to stop that immune response, we would like to find out why that immune response is occurring in the first place. And for that, we look to the gut. For that, we look to the liver. I mean, there's a lot of different places that you can search for that, and instead of just saying, okay, well, your immune system's overactive, we're just going to shut the whole thing down. Make sense?
Yeah, it does. Thanks.
Yeah, absolutely. That's why you see some of these side effects. You know, if you see a commercial for a pharmaceutical on the TV, there's this whole laundry list of side effects at the end, and you think about hijacking the body, and there's always going to be sneaky little, I mean, there's no way to do that perfectly, so there's always going to be complications, I guess I'll say, for those things. What else? Other questions? Yeah?
Best way to wash your face. Instead, water changes the pH. Is there a better way to like wash the face?
Well, we like to use something like a Nourish, where it's actually an oil base. And so you're kind of counteracting what you're doing. So for Nourish, how you use it is you go in the shower and you take a shower, you put some warm water on your face, and while it's still wet, you're going to put some Nourish on your hands and then put it on the skin like you would a lotion, okay? That will allow the pores to open up, and all of the lovely oils will get into the skin and replenish that acid layer. So as opposed to stripping the oils, right, we actually cleanse by replenishing the oils.
And you wouldn't rinse that off?
You can rinse it, but it's still going to feel like it's an oily topical. And basically that's what's allowing you to heal. There's avocado oil in there and grapefruit. And basically it acts like a roto-rooter within your pores and helps to break out that bacteria layers out of there if we have pore issues. The nice thing about the grapefruit that's in there is it has been studied in a lab to have antimicrobial pathways in there. So yeah.
And I just towel off. I don't rinse
Yeah.
afterwards. I usually don't use enough. I don't use a whole lot, so I just will towel off at the end.
A little bit of the Nourish goes a long way, like less than a pea size.
That's true of oil in general.
Yep.
Other questions?
Awesome.
Do you put anything on your skin after that? Any cream or lotion? That's enough.
No need.
Even if you have dry skin.
It actually will correct your dry skin over time. Most patients this time of year are struggling with dry skin. And I always tell everybody that I use Nourish consistently, and I have not struggled with dry skin in 2 years since I started using it. So, and I don't put any lotion on it except on my hands because I wash consistently throughout the day. Yes?
Extremely dry nostrils, and
Do you do any nasal flushes? Okay, nasal flushes help to create the bacterial balance back within the nasal and the turbinates. I don't always recommend like salt flushes because they can dry some patients. So I'll have them use a little bit of that salt mixture with a drop of olive oil or coconut oil in there to keep the turbinates moistened. And a lot of times you can knock out that chronically dry. So, and the other thing is making sure you have a good humidity going in the house.
Are you talking externally?
no,
Okay.
Yeah.
Oh yeah, a humidifier. Yeah, humidifier is a
Yeah.
big deal.
A lot
For
of
your
times,
immune system too.
yeah, check your furnace because a lot of people do have humidifiers on their furnaces and don't realize it. And you can turn it up or down as your furnace goes on or off. But if you burn with wood heat or pellet heat, like a lot of people do, it's going to create drier air, so you're going to have to add some sort of moisture to the air to help your body. And static. Any other questions? Well, thank you for coming.
Yeah, thank you so much. We really want to encourage you guys to come to the seminar on diabetes in 2 months. That's going to be a really good one. Dr. Denboer is super stoked about it. We are too. If you have any questions, just let us know.